the most popular program offered by SiriusXM Radio because it's based on one thing and one thing only. And that is rational thought. So welcome to the Wilkow Majority. I'm Andrew Wilkow. So we're gonna talk some more fraud here. I want to play a couple of clips. Yesterday, Vice President Vance and Trump's senior advisor Stephen Miller, made some really good points. And I don't know how this became a partisan issue. As I've said, and I'm going to get to Ambassador Andrew Bremberg on his piece that's on foxnews.com. If you believe in the activist government and you think it's the government's job to feed low-income children and to drive people to doctor's appointments and to fund daycare centers, but you find out the kids don't get fed, nobody gets a ride to the doctor, and there are no kids at the daycare center. Shouldn't you be outraged if you made this your moral centerpiece, were these grant programs, and then you find out that really bad people have stolen the money? Instead of questioning the character of people like Nick Shirley, or out of fear of, oh my God, what if I'm contaminated? What if people think I'm working with MAGA? You should be equally outraged. Play cut 4.
In just 2 months, we exposed billions of dollars in benefits that have been stolen from the American people. We've referred over $22 billion in fraudulent small business loans back to the Treasury for collection. We deferred more than $1.3 billion in fraudulent Medicaid reimbursements that were coming from various states, particularly California. We put a 6-month hold on enrollments for new hospice and home health care providers because so many of the newer hospice providers were not actually providing hospice services, but were just focused on fraud. So we're going to cut that out for a little bit and try to get to a place where we can actually certify that the people providing hospice services are actually providing those very necessary and important services. We've recovered taxpayer funds from the $135 billion stolen after the floodgates were open in the immediate aftermath of COVID. We have found $6.3 billion in suspected fraudulent government contracts, which were mostly awarded during the last administration, and that has stopped. And finally, we've blocked $60 million in student aid fraud that should have gone to young people trying to get an education, but instead we're going to fraudsters. And I think the theme here of the Anti-Fraud Task Force up to this point has really been that we're protecting two classes of victims here. We're protecting the American taxpayers who shouldn't have their money stolen by fraudsters. And of course, we're protecting the people who need these services.
Just for time, no, you know what? I think we have the time. Can you play cut 3? Stephen Miller pointing out, it's only 30 seconds, that we could balance the budget if all this money was recovered.
Not abiding by our laws, and the amount that has been fleeced from us is in the hundreds of billions of dollars. I believe, based on what I've seen and what I've heard, is that we could balance the federal budget if the only dollars that went out of the Treasury went to individuals who were properly, lawfully, correctly eligible to receive them. And that ultimately is going to be what we have to do as a country. In the meantime, because of the Vice President's leadership, you are seeing the most muscular, robust, aggressive, dedicated, determined, and speedy effort to shut down criminal fraud that has not only ever occurred in the history of this country, but in any developed nation. So thank you.
All right, joining me on the program right now, he is the former representative of the United States to the European Office of the United Nations and former assistant to the president and director of Domestic Policy Council, Andrew Bremberg. How you doing, sir?
Great to be with you.
All right, so I'm looking at your piece here, and you make it sound pretty simple. You're right. There are 3 practical steps that could be taken immediately to lower costs, expose fraud, and restore public trust in the healthcare system. The first one, you say, is give patients prices before care and empower them to join the fight against fraud, waste, and abuse. My only question about that is, what do you do with hospitals that are by law having to treat people who don't pay? So when someone says, why is a Tylenol in the emergency room $25? Well, it's for the 24 other people that didn't pay for them.
Great question. Let me just open by saying I think it was great that you played that clip by the Vice President. I think what he said is exactly right. And it's been so great to have an administration actually dedicated to going after this type of fraud. So that's been really important. I think the key is, and this is what I write about, is we need to expand this beyond not just how the government is spending its money, but to really enlist the support of millions of Americans around the country who are also themselves victims of sometimes fraudulent billing in the healthcare space. So one of the most important accomplishments I think that was done right at the very end of Trump's first term was he signed into law a provision called the No Surprises Act that required that every person who schedules care in advance gets a price for that care before they go in and receive the care. This doesn't apply to emergency services, which is only 5% of care, but in the 90 to 95% of care out there, people should be able to see a price before they go in and get that care. And that step right there would help reduce and cut down on all sorts of fraudulent overcharges that millions of Americans suffer every day this year around our country. And unfortunately, this is something that was supposed to go into effect in 2022 during the Biden administration, but the Biden administration did literally nothing to implement this. And that's why patients have been left both unprotected and not given the tools they need to help combat and fight fraud.
Well, I mean, one of the tough things, and there are a lot of, you have Bernie flying around, we have to fight the oligarchy. And, there are people that cheered the murder of the United Healthcare CEO. We have a system where, like you said, there's all these add-on things. The one thing the insurers know, and I'm not pleading their case so much, is that they know that hospitals and large-scale practices pad the losses they take by raising their demands for reimbursement from the insurance companies. So when they say, well, the insurance companies will only pay 80% of a procedure. Yeah, if they know that 20% is just baked in losses taken by hospitals who treat people without insurance.
Right. And I think this gets to one of the fundamental problems we have in our healthcare system, which is that, almost 1/5 of our economy doesn't run on free market principles, right? Nowhere else in our economy do you have that type of payment structure taking place that takes the consumer or the patient out of control, out of the middle of that transaction. They become kind of the subject to it. And you have these, large healthcare, cartels, whether it's on the payer side or the hospital side, that are basically pretending to negotiate and fight with one another when what they're really doing is stealing money from the consumers or from your employer plan that pays for your health care. And that's why seeing prices up front kind of cuts through all of that. All that negotiation has to take place on the front end when you see, okay, I'm going in for the procedure. This is the price the hospital is going to charge. This is the negotiated rate my plan has. This is what they'll pay. This is what I'll be responsible for. And you know that going in. If you get that and you think, wait a minute, that's not what I was expecting. That's way off the mark. You haven't already undergone the service. You haven't signed, a blank check to sign away all your assets to get this care. And you have an opportunity to shop around and find a better price. So you're not penalized. So I think this is something, as conservatives, we want free markets, but I think we frequently miss the fact that we don't have free markets in healthcare. If there are no prices to actually have competition and lower the cost, that's not a market economy. And we desperately need that. And I think what's exciting is the president's focus both on price transparency, but also now this rejuvenated focus on combating fraud is a tremendous opportunity for this administration to really go all the way and deliver that outcome.
This is what I don't understand. Yeah. How is fraud a partisan issue? Are you pretending it's not there? Like, when it's discovered, look, I don't care who does it. I don't care if it's a Republican or a Democrat, a natural-born citizen, an immigrant, a white person, a black person, a person from rural America or from urban America. Fraud should be treated as fraud, and there should be no sympathy for it. It's not just ripping off the taxpayer. And again, I said this earlier about Democrats. If you believe in the activist government, if you believe that that government has a moral obligation to ensure that no one goes without health care or nobody goes unfed or whatever the program is that you're talking about here, and that money's stolen, it means those low-income kids didn't get the meals. It means those elderly citizens didn't get a ride to the doctor. It means that the parents struggling to afford daycare didn't get the daycare, right? It means somebody stole from both the people that were intended to receive the service and the government and the taxpayer. That should be unacceptable no matter what your politics are.
Absolutely, absolutely, and I think, frankly, that is largely the case, which is why this effort is so popular and politically and going to be so politically successful. You're transferring over into the healthcare context. I mean, are you really going to say you're going to go out there and defend the poor little largest health insurance companies in the country that are ripping off Americans left and right, along with the hospitals, and you're going to come in and say, oh no, we need to protect these insurance companies from being able to stop stealing from patients and their employers. I'll just say real quickly about employers. Most Americans get their health care through a company. Over 160 million Americans get their health care through an employer-sponsored health plan, where the employer is actually just paying for the health care bills. They may have a health insurance card that has one of the carrier's names on it, but the actual entity paying for all that care is the employer. And what happens too frequently is that hospitals run up these massive charges to build the employer plan for that. And then the health plan, who's nominally supposed to be providing the network and discounts for the employer plan, actually basically overpays on behalf of the employer, and basically you get the spread pricing effect where they're functionally stealing from the employer and from the worker. So this is another thing that I write about that the Trump administration has the ability to fix very quickly this year, as the Department of Labor issues new regulations around deregulating the cost of healthcare for employer-sponsored plans and ensuring that those employer plans that actually pay the costs see the receipts. I mean, again, if you're talking about fraud, you should see prices up front. You should see the receipts of what was actually spent. Where did the money go? And this type of sunlight is the best disinfectant to all this fraud going around.
Yeah, well, I mean, look, another thing, I thought this was bizarre. When I read about what was called risk corridors, and then the less wonky thing was this Obamacare subsidies. So Obamacare said, okay, the government's going to pick 4 winners, right? It's going to pick 4 insurers. One of them was United, by the way. It is going to subsidize, give money to people to purchase something that we claim they can't afford to purchase. On the other side, we gave money to the insurers to create plans that were largely created by government to sell at a price they couldn't make money on. So the government said, well, here are plans. We're going to make 55-year-old men or 55-year-old women get a testicular cancer coverage or whatever it was. And if you lose money, the government will back you. Okay, so you're subsidizing the sale and the purchase, and you don't think that's going to create a market distortion?
Oh, absolutely. The lesson we should have learned from the whole ACA Obamacare debacle is that the government is not in a position to dictate how health plans are structured, how care is delivered, and the entire rules around that. And what's happened is that, and look, Obama promised us he was going to bend the cost curve. I always thought he meant bend the cost curve down, not up. And what we've seen is that the cost curve has gone up. Rather than lowering the costs, because we don't have prices, we don't have competition, costs continue to skyrocket. And then you get this whole argument about how much we're subsidizing whom. And look, across our government, we have different policies in place, from the tax code to entitlement programs, to help subsidize people afford the care that they need. And that's a fine conversation to have. But if we're having that conversation while costs are going through the roof, we are doomed to, in terms of how we're going to address that. Because even if you come up with some idea about how you're going to subsidize care today, well, tomorrow that deal's thrown out the window because the costs have continued to explode, which is the real key is getting costs to come down. And I'm sure you've seen all these charts around where you see how every sector of our economy, the costs have grown or come down over the last 10 or 20 years. And as healthcare services, particular hospital services, have led the way, 300% price increases, while so many other sectors of our economy, costs have come down. And it's because we don't have prices. And as conservatives, we know markets work. There has to be price competition, and the administration needs to hold both the hospitals and the insurers accountable by making sure that they provide prices for care before patients sign on the bottom line.
Also, this might rankle the AMA, but we're in a stage, and I use the same story every time because, urgent care has been one of the best, capitalist products in healthcare in a long time. But I remember it was years ago. We were at Disney. My kids got sick, and we went to a walk-in clinic. There was a physician's assistant who swabbed my daughter's mouth, stuck it in a machine, and said, "You've got flu A." And I thought to myself back then, this is about a decade ago, conceivably with technology, I should be able to walk into the pharmacy and swab my own mouth. You know, if the machine is telling the physician's assistant that my kid has flu A, why can't I swab my kid's mouth and have the machine tell me that I have that they have flu A, and spit out a prescription? Now, I'm not trying to cost us healthcare jobs, but wouldn't doctors and other healthcare professionals be better off treating more important things rather than, if I feel sick, I got to go down to the doctor's office. I got to sit there in the waiting room for an hour. And once in a while, they make you fill out the paperwork again for the 8th time. My address has not changed. My emergency contact has not changed.
Right.
Well, we're just concerned. So can you fill out these 4 pages again? Ah, damn it. If anything, we could bring speed, efficiency, and cost reduction if we ask ourselves a serious question. Do we need to see the doctor for everything?
Oh, I certainly agree with that. I think one thing you saw the Trump administration last year announce is a whole kill the clipboard initiative to try to finally do away with exactly what you're describing. This needlessly bureaucratic process where we constantly have to fill out a new clipboard paper form with our insurance information, our health history, our address. So there's a progress going on right now to help do that finally. But to your point, yeah, I mean, doctors should be practicing like real medicine. If we've got, in terms of doing significant treatments and more complicated diagnoses, anything that we can kind of, automate and bring down at a lower level where individuals or with, lower level health practitioners can better do that will help both lower costs and utilization and lead to better health outcomes. So the exact story you just gave is a perfect example of how that should become a lower, but both through technology and price transparency should be a lower cost intervention that says, oh, hey, for a cheap amount of money, I can go over here and just do a self-service test over at this kiosk and, take the swab and stick it in there, let the machine read it. Great. I mean, that's what
they're doing anyway.
That our system thrives on.
But that's what they're doing anyway. Right? I mean, right. I have somebody, and again, I'm not trying to cost that person their job. I would like to find more important and more crucial things for them to do than sit there all day swabbing people's mouths that could swab their own mouths. And now that it's kind of like, look, and I'm not trying to cut optometrists out of anything, but the more you force people to seek a service that they would be cheaper. It would be cheaper for them to serve themselves is what I'm saying, right? I mean, I'm not trying to get rid of the optometrist, but if you could look into something and AI says, here's your prescription, you might be able to walk out of there with a pair of glasses a lot cheaper. And if the concern is low-income people, well then, like you said, let the competitive marketplace produce a better product.
Oh, exactly. And we've seen that across all sorts of other sectors of our economy where technology has come in and innovated and created new opportunities for people to lower costs, lower burdens across the board. And we need that to happen in healthcare.
All right. Look, again, we should be utilizing all the tools of technology and free market capitalism to bring down costs and have a better outcome and strengthen the system, not weaken it. And please, God, no single payer. Ambassador Andrew Bremberg, thank you so much for joining us. You could read his piece at foxnews.com, 3 steps that could stop fraud and make healthcare more affordable for all Americans. Thanks for joining us.
Thanks.
All right, 1-866-95-PATRIOT, 957-2874.